The Lagos State government is adjusting its health insurance policy framework. The changes take effect from August 1st. The government says the move aims to boost enrollment and protect the vulnerable. It also seeks to strengthen the sustainability of the social health insurance program. The permanent secretary of LASHMA announced this on Thursday. Dr. Emmanuela Zamba spoke at the agency's media parley in Alausa, Ikeja. She says the changes address growing concerns about residents who abuse the scheme. Some people only enroll shortly before accessing costly health services. They then hesitate once their medical needs are met.
After enjoying the services, they leave the scheme and only return when they require another costly medical intervention. This attitude is not healthy for the sustainability of the program, and these practices will be addressed through the forthcoming policy changes. The aim of the program is to ensure that it is sustained and it is accessible to everyone in Lagos State.
Zamba says this practice threatens the long-term viability of the scheme. It also undermines the principle of shared responsibility on which social health insurance is built.
I must say that data is key to the sustainability of social health insurance, and as part of our efforts to ensure transparency and accountability, today we will be presenting the LASHMA scorecard from inception. This testifies to the operationality, functionality, and impact of this program with respect to providing healthcare to residents that is not only affordable but also qualitative.
I am not here to tell us what LASHMA does. It's what we know. It is a critical period for us to tell people our story, because as you all know, the election year is coming around, and people will be asking, what have you done? I know LASHMA as an agency of government has done so much, especially in the health sector. And that's why at every quarter we invite gentlemen on the first to judge up.
The agency says the adjustment will preserve access for indigent residents. Those who genuinely cannot afford premiums will still be protected. LASHMA also shared updates on its scorecard since inception. The agency launched the Assistance in Distress initiative in December 2025. The emergency service program began in March 2026 and has already saved 18 lives. Mandatory health insurance commenced across state government agencies from February 1st. The next phase will focus on the informal sector through grassroots sensitization. The agency also expanded its rural health outreach to underserved communities. A mobile health van initiative brings health care closer to residents in remote areas. 72 health writers and their families have been enrolled free of charge for 1 year. Zamba described journalists as key partners in public health education.
I wish to state that the agency is also ready to train other health writers who have not yet been trained on social health insurance no later than the 14th of July 2026. So if you're in this room, you have not been trained, please leave your name and your contact before you leave. We'll be in touch and you can come for the 3-day training in July next month. I implore you not to relent in your efforts to ensure that everyone in Lagos is adequately informed, educated, and enlightened about social health insurance so they can understand its importance and register for the scheme.
The LASHMA boss urged residents to use the ILERA EKO telemedicine service. Enrollees can consult medical practitioners remotely in multiple languages at no extra cost. Zamba called on journalists to continue sensitizing Lagos residents. She says ILERA EKO is now mandatory for all residents and essential to reducing health care spending.
Thank you so much for your efforts.